Counties in Kenya are struggling to contain the COVID-19 pandemic and are scrambling to get their hands on intensive care equipment, especially ventilators, which are needed in the most critical cases. Nakuru not left far off behind. To contain the spread of the virus in the county, senior securities officers met in Naivasha to strategize on how to conduct a major crackdown targeting those flouting COVID-19 regulations. Addressing the press at the sidelines of the meeting, CSC for Health Dr. Kariuki Gichuki said that 222 health workers had tested positive of COVID-19, though no death had been reported.
Luckily, we have not lost any health worker in Nakuru County to COVID, but we have admitted many and discharged many. And a few have been even to ICU and back. So we are very, very happy that for that milestone, that none of our health workers has actually succumbed in Nakuru County, and that we are able to give them those services, and they are confident that we can manage them if they get sick. As long as you are a health worker, when we admit you, the cost is to the county government, fully.
Gichuki admitted that rising cases were overstretching health services and workers.
So we want to make sure that everybody who lives in Nakuru is able to follow those rules, like wearing a face mask, social distancing, and washing your hands very often. So if we are able to at least sensitize people on all those issues.
He noted that past experience had proven that whenever there was a crackdown, the number of positive cases dropped, and hence the joint effort with the security officers.
And there is evidence to that, because every time there is enforcement, we see the curve going down. And we think this is a simple strategy which we can do, and we synergize together with the national government who have the responsibility of enforcement. We will do very well.
While calling on area residents to observe the laid down procedures like wearing masks and washing hands, Gichuki said that a total of 30,251 people had been tested in the county.
Our case fatality rate is 2.2%. That means out of 100 people who will get that problem, 2.2 are likely to die. And the overall positivity from when we started COVID up to now is 11.7%.
On his part, the Deputy Governor Dr. Eric Korir noted that rural areas were now the most affected by the surging cases.
We enhanced testing, and the enhanced testing from 1,000 to 2,500. We saw a spike because the numbers were very large, but in the real sense, it's just the numbers which we did following the WHO guidelines, so that for us to get a very good statistic of what's happening, then we need to test more and more.